Yes, so today we are talking about the signs and symptoms of prostate cancer. Yesterday we introduced what prostate cancer is, and then the stages, and then the risk factors. So today we are talking about the signs and symptoms. One is that it usually causes urinary retention. In this case, someone goes out to urinate and then they cannot empty the bladder fully. Either urine remains, some part remains there, or it can be dropping. Two is the pelvic pain. The pelvic is the space that is between the thigh bones, that inside the space. So it usually causes pain within that area, especially when it has spread or when it is in the late stages. We usually get pains within the bladder sometimes. Some people experience blood within the urine. Sometimes this blood is visible, other times it is not visible, but when it is examined, it can actually be seen. Other times we usually get urinary urges where someone feels like they have to urinate there and then. Whenever they get the urine, they feel they want to empty the bladder there and then. The other sign that usually happens is that some people get frequent urinations that is not very usual. Those are some of the signs. The other thing that we are going to talk about today is we want to talk about, for example, how can we detect, what should we do to detect whether someone has this. One, for you to detect, as I said, the challenge we have with the prostate cancer is that it comes gradually, so it is sometimes difficult to detect in early stages because it is gradual. But one thing that we can do, one, is when you start identifying the signs and symptoms that I've talked about earlier on, then two, when you start experiencing besides the signs and symptoms that cause that discomfort, usually when you start experiencing unusual pain, urinary retention, blood in the system, just to recap what I've already said. But then we also encourage regular checkups, especially when a man is from 40 years and above. You can always go and do regular checkups. There is a test which we call PSA, or prostate specific antigen. It is tested within the blood system, and when it has a limit, when it goes beyond the normal limits, usually we can tell. It's a very important test, and it's the confirmatory test which we can base on. Sometimes you may not have the prostate cancer, but you may have what we call the benign hyperplasia, or BPH. Sometimes we call it BPH. A prostate may just have enlarged but not necessarily cancerous. But doing these tests will help to confirm. The other thing is that is when they do a physical test, but that usually that physical test of palpating or checking the prostate may not necessarily confirm you have prostate cancer, because a prostate may just enlarge due to age. So PSA is the most confirmatory test that we usually base on. It is very, very, very important as a man to ensure that irrespective of the circumstances that are there, even when you're not feeling any signs, you're not feeling any pains, to do it so long as you are of an age that is 40 and above. It is highly encouraged. Tomorrow we shall talk about what are some of the things you can do to prevent prostate enlargement.